Are you tired of juggling a dozen different apps just to manage your practice? It's time to simplify your life with Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Dr. Chrono seamlessly integrates patient engagement with scheduling, clinical workflows, and medical billing, allowing you to manage your practice wherever you go. To learn more about why so many other primary care practices love Dr. Chrono and to start your free trial, visit drchrono.com/free trial. That's drchrono.com/free trial. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
DPC is health restoration, valued-based with increased patient satisfaction and proven patient outcome. Not to mention the renewed patient passion in medicine. The joy of DPC has given me so much freedom to spend quality time with my patients, provide that continuity of care, and also to have work-life balance. I am Dolapo Babalola, owner of Living at Your Finest Wellness, and this is my DPC story.
Dr. Dolapo Babalola is a triple board-certified family, obesity, and lifestyle medicine physician, an adjunct clinical professor at Morehouse School of Medicine, and the owner of Living at Your Finest Wellness, a membership-based holistic and integrative direct primary care practice in East Cobb, Marietta, Georgia. Dr. Babalola completed her medical training at the University of Guyana and family medicine residency at Morehouse School of Medicine. Dr. Babalola practiced clinical and academic medicine at Morehouse School of Medicine, Department of Family Medicine for 15 years, where she completed several reputable fellowship programs. She presented her scholarly activities at local, regional, and national conferences, was published in peer-reviewed journals, and won numerous awards, which signifies her commitment to patient care, teaching, and research. As a family physician, Dr. Babalola provides full-spectrum family medicine services to people of all ages, from cradle to cane. Her area of expertise is helping individuals and families live at their finest well-being using a holistic and healthy lifestyle approach to prevent, treat, not just manage, and in most cases reverse lifestyle-related chronic diseases. Dr. Babalola loves to empower her patients, community, and learners about ways to restore health and wellness by discovering the root cause of preventable diseases. Dr. Babalola is the physician walk leader for the Marietta Walk with a Doc community event. On a personal note, Dr. Babalola is a wife, mother of 3, author of an inspirational book, adventure seeker, podcaster, lover of God, and a community builder through engagement with different organizations. Thank you so much for tuning in. My DPC Story listeners, you are amazing. It is so incredible to continue to see people engaging with direct primary care and jumping on board as physicians who are tired of practicing in fee-for-service. So be sure to check out mydpcstory.com for resources, discounts, my favorite tech tools, and more. And you will also find the blog accompanying Dr. Babalola's podcast. So with that, thank you so much, Dr. Babalola, for joining us today. I'm so excited to see you again. This time I wish it was in person, but we'll do with Zoom.
Yes, the pleasure is all mine. I have been looking forward to this time on your amazing podcast. So thank you so much for having me.
It was not too long ago that we were speaking about DPC in your clinic in this last May. And not to be a downer here, but we are talking at a time where the nation, multiple states, especially North Carolina, has been hit by a tremendous weather event that I'm sure people did not expect it was going to be this bad. And I think about that, especially jumping into our interview, because when we were in Marietta, when we were in East Cobb, Dr. Anand Mehta's clinic had flooded a second time, and not to the extent, thankfully, that anybody who has been affected by Hurricane Helene has experienced. But just this idea of you were offering, like, hey, use
Yeah.
my space. He has since reopened. You were
Yes.
sharing that you've had a little bit of clinic damage to your clinic, but you and your family are fine. And I
Yes.
just think about we only have so much time here on this earth,
Mhm.
and how are we going to spend it? So I just wanted to put that out there. And also, if you are a DPC physician who is in need of something, lidocaine, whatever it is, gauze, definitely please go to the contact page at mydpcstory.com, and I can do whatever I can to find the connections so that we can help as a community get supplies to those people who need them, guided by you telling us what you need. So with that, back to your journey into choosing to not do sick care. I love that you say that on your website. You were so involved in not only the education of your community, but the education of your medical community. And you chose to do direct primary care. So bringing me back, please, to those days where you were 15 plus years into doing all of the things, all of the incredible things that you were doing, and yet you decided to go a different path. So please help myself and the listeners understand a little bit about Dr. Babalola pre-DPC and post making the decision DPC.
Yes, certainly. It took a while. It was a journey, I would say. It took the last people that know me, the last 5 years of being in academia. I was just like, oh goodness, I love to teach. I love the environment. I was taking care of patients in the underserved community. If you've learned about Grady, they say Atlanta can't live without Grady. So I enjoyed it. It was just joy for me. My patients loved them dearly. But the act of medicine was just always, I felt like I was always rushing. I was always rushing. I didn't feel like I was serving them, even though I was that one doctor that was always running behind, right? Because I would spend that extra 10 minutes to explain things to my patients. I was focused more on skills over pills, and I really wanted to get to the root cause. But I felt the burn at the end of the visit. I would have 26 charts to complete because I really wanted to connect with my patient. I didn't want to do all the paperwork and the processes they wanted us to do. So I focused on my patients. My patients were fine, but I wasn't. And year after year, I felt like my life was just unfolding into things that I couldn't recognize. I had had blood pressure issues, which I was able to reverse. I had gained so much weight, which I was able to take care of when I learned about, lifestyle medicine. So that saved me in 2020. And I think that was when I realized that, okay, I cannot keep touring with this and trying to figure out what is out there. And I felt, how they say the grass on the other side isn't always as green. So I stayed with it because I didn't know a better way to practice until I heard about DPC. And I was like, oh, okay, well, direct primary care without the involvement of the insurance company, this seems doable. So that was what happened. I just got frustrated. I felt that I could not keep doing medicine. I lost the joy and passion for medicine. But when I found out about DPC and a better way to serve my patients, and also, the academia part, I can still teach my learners how to practice medicine, the joy of medicine. And that was something that they all observed towards the latter part of my, academia part. They saw it and they realized that there was a different way to practice medicine.
Let's talk about that, because that I think is so interesting to see. It will forever amaze
Yeah.
me how people younger in their careers, at a younger stage in their careers, not necessarily by age, are recognizing, what is this that you guys do? Like, why aren't you asking, is it okay to see 30 patients in a day or be double booked or triple booked? Like, why do you keep practicing like this? Is what a lot of people earlier on in their career are
Mhm.
asking. And so tell us about those types of conversations that you had, because what I was so blown away by in such a good way was that when I was in the Atlanta area, when we were at the mastermind earlier this year, people who were your residents had opened up DPCs just a little bit before you. And it was just like, this is absolutely a representation of, it doesn't matter where you are. Like, if you get somewhere and you reach back and you say, hey, come on with us, it was
Yeah.
just this representation of bringing everyone together. So tell us about these conversations that you would have, given that your residents seem to be the smart people that I see in medical school and residency. And they're like, what are you people doing?
Right, right, right. I'm glad that you asked that question because sometimes I sit back and I wonder, how did I do it the early part of residency? I mean, so residency, we all knew we had to learn and graduate, right? But then when I started, I stayed on at Morehouse as a faculty. And I know then I had 5 days a week of clinic, but it was okay. I didn't know anything different. It was fine. I did it, right? I saw patients. But then as time advanced, I realized that this is not sustainable. I'm not serving my patients. There was a lot of patient dissatisfaction. There was just more and more metrics and measures that had nothing to do with patient care. And I, in my role as a clerkship director, my students saw that I needed them not just to find out about what medication a patient was on, what medication, what is it doing, what is their lifestyle habits. So they started understanding that. And based on just shadowing and just working with me in the clinic, they realized that it's not sustainable to see that many patients. And then they saw the difference where when they were with me and when they went to another practice where they really didn't care, and they just, not because they didn't care for the patients, but it was all those metrics that were in place that they had to follow. So they saw the difference. And those conversations came up during our didactics. And so when I finally decided that I was going to move out of that, and I've had people come to the practice, they are blown away that how the difference, the quality, the joy of medicine. Because a few people just decided, you know what, I don't think I want to continue with medicine. We had a few people that changed their mind just because of what they saw the doctors do, frustrated and tired. And to your point, Dr. Michelle Cook was one of our residents, and I heard her talk about DPC, and I called her very quickly. I said, what is that? I've been hearing more about. And she guided me. She connected me with Dr. Mata. I mean, amazing journey, the turnaround and how we all support each other, and just learning the freedom of just patient care and getting your time back. It's been a roller coaster. So I'm always joyful to share this. And when I see the light up of the residents, when they come and work with me and they see that, yeah, this is the way it should be. And that's really where we're moving towards health restoration through the DPC model.
Absolutely. In our kitchen, we have on the counter floral arrangement that our former attending sent. And she does DPC. And then at the conference that we just had in Dallas, one of my co-residents in my class just showed up and texted like, are you here? And I was like, oh my God, because other people in my resident class have been like, the voices are going. And I'm like, the song, Another One Bites the Dust, or, the visual of dominoes just falling. It's like, if the system is so broken that literally it is a domino system falling versus like, nope, here's a trampoline. You throw that domino and it bounces back up. Like, that's what DPC is. And so I absolutely love that this is how you learned about DPC, because you understand it differently also when it comes from someone, one, that you know, and two, someone that you taught.
Yes, absolutely. Absolutely. I just love the transformation. And that's what I find in the DPC family. I even reached out to you when I learned about I don't know if you recall, a while back, I wanted to talk to as many people. Is this for real? Does this exist? Because I knew that until I find something that was better than what I was doing, I was just going to stay put where I was. I'll just keep suffering. Either that or I just quit medicine altogether. But, so I'm just really pleased and so joyful to have found DPC, and also to show that there's a better way to practice medicine, and also for patients to see there's a better way for them to care about their well-being.
Let me ask you there, though, and I will call out here, it is wonderful that you stayed in medicine, because clearly you are making such an amazing difference in your community, the health of your community, and you've just already passed your 1-year anniversary. So belated congratulations on that as well.
Thank you.
You have a triple board certification. So you are board certified in family medicine, board certified in lifestyle medicine, and board certified in obesity medicine. And I want to ask here, because I don't know the answer. Did you get those lifestyle and obesity medicine certifications after you left the role that you were in prior to living at your finest? Or did you do a portion of that before leaving, knowing that in that last 5 years, you were like, I'm looking for another way to practice?
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
So, I'd always been practicing lifestyle medicine without that name tag on it, right? Because I was always preventative focused and, research driven. I'm a data driven person. So even when I was in the early stages of academia, I would collaborate with the American Diabetes Association. We did a lot of collaborative work. I ran the group visits for the diabetes clinic. I did that for 3 years. We had fantastic outcomes, but then they said, you know what? No, we want you to be in clinic seeing patients. You're not doing that anymore. So I had always had that mindset. And again, there was the period where I had to heal myself and I really needed to get more additional training. Again, in medical school, we weren't taught enough about nutrition. Now, the pandemic happened in 2020, and that was where I got those certification, lifestyle medicine. I actually started out with obesity medicine. And the way obesity medicine fell on my lap, because I was the director for the medical students the third year, the OMA reached out to me with their resources and said, well, everybody's at home now. Your students are at home. Can you provide this information for them? And I started looking into it. I promoted it in the department. This was a lot of great information. So I decided to get certified there. And then through AFP, I got a scholarship for lifestyle medicine. They paid for it because I was interested. And so that's really when it happened. We had a lot of time in our hands. So I got all the knowledge. And I started the lifestyle medicine interest group at Morehouse School of Medicine, and a lot of other things started. So that was really when it happened. And it was so liberating. And just even understanding that convinced me more than ever that 12 minutes is not enough to care for our patients. And yeah, so that's exactly how it happened.
And 12 minutes is like a gift in a lot of clinics, unfortunately. But absolutely, yes, that is so true. The fact that you crave those, just can I have one more minute? Or can I ignore the fact that I need one more minute and there's so many people waiting in the waiting room? It's terrible. It's terrible. Yeah. And that's why we have left. So let me ask you there, because you mentioned how you talked with Dr. Michelle Cook, who has also passed her 1-year anniversary, which is congratulations to her. This conversation that you guys had in terms of not necessarily just a single conversation, but the overall hearing what she was doing, hearing about direct primary care. I want to ask about how you then made the decision to go into direct primary care. Did you have a break between fee-for-service and direct primary care? Or did you plan financially and looking for spaces, all of those things to plan before you opened? Or did you do those things after you had stopped working fee for service?
Right. So in 2020, when I got boarded and certified and I realized that, okay, yeah, I have this additional training and I cannot put it to use, I actually went to my medical director and I said, can I have a lifestyle medicine clinic? Because I was still planning to stay, right? I said, I have this additional training. I had become, I was on my way to becoming full professor. I'd reached all the requirement. And they told me, oh, yes, I'm great. I'm glad that you have all this certification. How about adding another clinic? And I said, okay, really? I mean, you can just convert one clinic to so that was when I figured, I said, okay, yeah, this is not going to work. So I started talking and I heard about DPC, but when I saw people that I knew doing it, that was when so this was October 2022. I knew that I just needed out, and all the places. I didn't start off wanting to open up my own practice. I always want to say that because I'd always felt that women that do it in particular, caps off to them. It's a lot of work being a mom, a wife. And I felt like I didn't have any entrepreneur bone in me. My parents are academias. My father was a professor, my mom a lawyer in academia. So I felt like I really didn't know how to run a business. So I was looking for a practice that was, aligned with the way I want to see patients who will hire me. And they were all out of state. And my family said, my husband and kids were like, okay, well, bye. We're not going with you. Sorry. So I figured when I heard about Dr. Michelle and other people doing it and speaking with them, I realized that let me open up my practice. Now, what sealed the decision was October 2022. I was just praying, driving to work. I remember the very first patient said to me, I've been seeing you for 7 years. I don't want to lose the relationship, but I have to move in with my daughter. Do you have a practice elsewhere? And that was all she said, because for many years, people had always asked me if I had a practice, and I just laugh and I tell them, well, yeah, no, this is it. This is Grady. I don't have a practice anywhere. But for the first time, I said, you know what? I think the Lord is leading you to me. That was it. That was when I made my decision. DPC. So I had that whole period. So from October 2022, I figured I will open up fresh start in July of 2023. That was last year. So I had all that time to plan. So I had 6 months. I turned in it was really supposed to be a 3 month to let my chair know. And so I had a lot of time to search for space, to save up and do all the research that I had. So that's really where, and then I joined the DPC Facebook group. And so just learning and gathering all the information. So that was the journey.
Incredible. And tell us about your space, because I'm jaded because it's beautiful and I've seen it in person, but tell us about the journey to find the space and how have you personalized it to be your own?
Yes. So the space was a very interesting journey. It actually took 4 times. I got rejected. It was the fourth one that I finally got this space, and it's barely 6 minutes away from my home. So it's so interesting. When the people tell you that when one road closes, another opens, this is real life true. So that was the longest journey. I think it took about 4 months. So from the moment I knew that I was going to open up my own practice, and I had figured that the following year, for the new academic year, I would just leave Morehouse, finish out that whole year. I was looking a few places, just didn't work out. It wasn't panned out for a clinic without not so much money built out. And again, I didn't want to, my husband kept saying, very low, maintenance. I don't want to take up a whole big loan. I'm when it comes to loans, I don't like loans either. So I really was looking for something that was within my budget. So the first 3 that were within my budget, they just, I guess, because I didn't have enough business experience, even though my credit score was really high in the 850s, they went with the other option. So I was discouraged. I will not lie. I did ask my husband if I could use our basement to start. And he said, no, you can't, because when he wanted to use the basement to start his law firm, I said no. So I was like, okay, cliche. So I kept quiet. And I was just a little discouraged. And lo and behold, I did get a realtor. I had no idea. I was doing all the work myself. So my realtor was very instrumental. She found this same location that I'm in. It's barely 6 minutes from my home, and it was set up correctly. So the rooms have the sink, and the builder, from what she had gathered, the landlord rather, was really going to spend almost 7,000 to 10,000 in painting and getting the whole place set up. So I really didn't have to do much. And, it was set up really nicely right by the main road, a lot of other professionals in the area. And I had told myself, I said, because of, I guess, the trauma that I experienced being at Grady, everybody sitting down so close to each other with the TV, giving the news, and people will come across and their blood pressures are high. And they wanted us to just keep increasing medications because to meet the metrics. I said, if I ever open a practice of mine, it's not going to be this way. It's not even going to be called a waiting area. So my space is very welcoming, and I love it that way. Sometimes I have to remember that I have a house to go to because I hang out in my own practice. My kids, my husband, they were all instrumental to getting it to where they knew what I wanted. I really wanted it to be soothing and calming. The first patient that came in with my waterfalls by the entrance, she said she has never been to a doctor's office where her blood pressure wasn't high. She always had white coat, but she was totally just calm. I do have a massage chair. Some patients actually get a massage before their visit. So it's just the way I envisioned that I want to be served. That's how the practice is. And we arranged it and laid it out that way.
And she's not kidding. Like, if you picture a square, like 75% of that is this massive wellness area with this massage chair. And it was like, darn it, I wish we weren't here for a mastermind, because I would totally sit in that massage chair. And it's beautiful. The colors are soothing, the greens that you have in your clinic. And so I just think that it is so wonderful to hear that backstory, because you had what you did not want in your head when you built that space out. And you've definitely understood the assignment. So that's awesome. The assignment you gave yourself. I love it.
Yes.
Tell us about your experience with the realtor. Do you have any advice for other people when they're talking to realtors? Because clearly we're medical offices, having a sink, absolutely. I appreciate that myself now that we have our own building. But Do you have any tips for other people in terms of the conversations that you had with your realtor to make sure that the time that was being spent in the correct way to find you the space that is now yours?
Yeah, so I think the biggest lesson learned is having that conversation with your realtor for them to understand what your goals are. Because eventually when I decided to use a realtor, I'm not paying her. She's going to be paid by the landlord. I sat with her and I really appreciate her because she was also very proactive. She asked me some questions because she really wanted to be certain what my goals were. And so we had that back and forth conversation where she understood DPC, direct primary care, and she became a fan of it because I sat with her and explained it. I told her the kind of reception I wanted my patients to experience. I know a lot of places were like pushing for 5 or 10 years. And I told her, no, I don't want that. I want 3 years. And so she had to pivot a little with me because there were places where she would see 5 or 10 years and I really didn't want to do that. So just having that conversation, and if they're not aligned with you, then find another realtor, because if they're trying to push their own agenda, that is not somebody that is serving you. So I'm grateful that I had one that, listened to me and was my own advocate, who really wasn't pushing her own agenda, because again, they do get paid by the landlord. So that will be my biggest advice, is make sure they understand what your goals are. So my space is 1,800 square feet and it reasonably per square feet. I mean, it was $16 per square feet. In East Cup where I live, compared to all the other places, they were much higher. They were like $20 or $21. So that was a good price. Another thing, make sure that your landlord, tell your realtor if you want to sublist, because again, that is a big space. And my thought process was I was going to grow into it. And because I'm I just love doing multiple things. So I figured, and I like to work with other team. So I figured I would have, other people to work with me, and the landlord agreed that, okay, yes, you can sublease. So you want to have that conversation. If you have whatever space, whether it's a one room, just let them understand what your goals are and how long you want that lease for.
And, again, not to be a Debbie Downer, but just because it is a real thing when you have a business space, how you were sharing before we started the recording that there were some tiles that were affected by the weather. Do you have any advice for people in terms of negotiating within a lease for protection for things like environmental damage?
Yes. So I must say that my landlord is a fantastic guy. He really is. And that's another thing. You have to make sure your landlord is not dubious, and this already when you're going back and forth on your lease, right? Your contract. This guy was fantastic. Again, the the 3 that I had before this one, you could tell that, somebody will keep me for several weeks and not say anything, and last minute tell me, no, we're not taking your contract. So he was really good from the very beginning. You know how they tell you if somebody tells you who they are, you better believe them. So he was good. So he covered everything. So when I had the issue, when we came on Friday after the storm and the whole tile was down, I asked my husband, I'm like, who's going to cover this? He said, remember the contract that they had actually written? My husband is an attorney, but again, my realtor had made sure that anything that is within the building that it wasn't me that cost it was going to be covered by them. So it was already in the contract. Now, I do understand that some landlords will, kind of like change that up. But when I was concerned, my husband said, well, just send him pictures and let him know. And he got somebody right on track immediately, and they've taken care of it. So just make sure, yes, that whatever heater, all the stuff, who is covering it, what is covered by who, and that makes a big difference. You want to put that in your contract from the very beginning.
Wonderful advice. And like the total opposite experience was what I had. And so I think it's so important to, if you heard that and you're looking for a space, stop, rewind, listen to Dr. Babalola again. But, I had a contract that said if there's earthquake damage to your space, you're responsible for that, as well as the earthquake damage to the building, like the whole building. And I was like, what is that? Like, it's like a fee for service contract with exclusivity and evergreen phrases. It's like, do you think that we don't read? It's like, golly. So I'm very glad that you had your experience in the way that you have and you continue to have. And that's why you continue to stay. So definitely it's in your best interest to be a good person always, but especially when you have people you are renting a space to. Let me ask now about you making the decision to open your own clinic. You mentioned that you saved. Do you have any strategy advice for people in terms of they are planning on leaving, or for those people who are planning on purchasing a building, how to save, whether they're in fee for service or financially, looking back on your first year, how to save if they're already in DPC?
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
So again, when it comes to naturally, I like to save. I save, and I do not like having several loans. I mean, the biggest loan I have is my home. I've already paid off for my car. So I'm naturally that way. And everybody needs to figure out who they are and, to determine. So there's no right or wrong. I would say some people I listened to your amazing podcast. So I've heard different opinions. Some people get a loan, but for the most part, again, because DPC can go as low as your low budget, low overhead, your savings can help you well enough. So what I did is I borrowed money from myself. So it was my mutual funds that I was able to withdraw when I was leaving Morehouse. So that was what I used. And a lot of the items, Dr. Mata was very helpful, sent me a few people that he was able to get used tools from. Dr. Michelle Cook was helpful. So I got a lot of my things that I have. My biggest cost was my InBody scan. That was my biggest cost. It was running for 12. I got it for 8,000. So, and then my beds was from a colleague who had a practice, free for service practice 10 years ago, and then had them in her basement. And I just told her, I will buy them from you. And she was like, no, take them. So, really finding, for me, it was very important to spend money where it was most needed. And if I didn't need to, I could use, fairly used items. So that's really how I funded my practice. And the first year was not at a negative at all. And again, I didn't, other than a virtual assistant, I didn't hire anyone my first year, so all of that kept my overhead low and my budgeting was within means. So that's what I would encourage is, first of all, there are all these templates in the DPC doc. You can, I know there's so many of them. Just create something, whether it's an Excel file or something, to just budget the main things that you need, put your cost, and of course, the biggest cost will be your lease, right? And so factor that in your day to day, and you just take it one day at a time. That's pretty much how I've done mine.
Love it. And that's so true. Like, no matter what community you're in, like literally one of the things that I love to do is I love to change the location of my Facebook Marketplace search radius when I'm like visiting different places for conferences and whatnot. And I'll see like what's available. And I really have texted like, hey, you are needing this lamp, right? But literally, like, you can find so many people these days, especially who are like, they, for whatever reason, are closing their medical clinic, their dental clinic, their tattoo parlor, whatever it is. And there's so many ways to approach how do you get the things like equipment without buying the brand new shiny things. And that's also possible, fine, but there are ways to do both, I should say.
Yes.
So let me ask you here, because I remember when you were like thinking about this and you reached out, because I was like, oh my God, you're on Meta, like you're in the Marietta East Cobb area. Like, oh my gosh, connect with him. But it's amazing that you guys continue to still be this amazing DPC community, and yet you have your own take on DPC. If you've seen one DPC, you've seen one DPC. So how did you go into that knowing that there is a supportive community around you, and, not get into the like, oh, they're my competition thoughts? Because clearly that is something that people will say like, oh, if I open a small business and it's the same service as another one, I might be competing with them. And like you said, Dr. Meta already sent you patients. So talk to us about how did you identify Living at Your Finest as its own clinic, and you're bringing a unique thing to your community as part of the community?
Yeah, I mean, you said it. We're all different individuals, right? We're all uniquely made. And I want to say something about Dr. Mehta. When Dr. Michelle Cook had introduced me to him, and he's barely a few minutes from my home. And so he had said, yeah, come on, come shadow me. And it was funny because the patient that we went in to see, the moment he introduced me as a fellow physician who wants to start a DPC practice, you know what the lady said? Why would you bring the competition in to shadow you? And Dr. Mehta, I was like, oops. And then Dr. Mehta said, no, there's no competition. We are all doctors that are trying to do the best. And within that session, I think it was about an hour or there, about maybe 45 minutes, he asked for my input. It was some issue with sleep, and he asked for my input. And he told the patient, you see, you have two doctors now helping you out. Some things that I had mentioned that he wasn't even aware of, that the patient took advantage. So, I mean, she was very relaxed at the end of the day. But yeah, to your point, I've never seen it as a competition. Again, I love that DPC doctors want to help each other. When I talk about DPC online, even if it's not my practice you're a part of, because I believe so much in the model, I am putting like the DPC mapper there. Find a doctor, any networking meeting, I tell them, this is what you need, a DPC doctor. Find a doctor in your area. So certainly people, I mean, in my area, it is saturated. I must be honest. Dr. Mata is there. We have Dr. Anderson. So there are those thought processes that do cross my mind because my practice has been slow growing. And again, unlike the two doctors that are in the area, they moved very close from where they used to work. I came 45 minutes away. So I'm growing from scratch. So there's all that thought that comes through my mind, but I still accept that I'm different and I'm unique, and what is mine, and whoever comes and finds me, finds me. So that's the way I embrace it. And yeah, I'm grateful for the patients that I'm able to care for.
I love that. And that is so true. And I think about a doctor out in Colorado had messaged, hey, there was a family that joined the practice because they heard about it on your podcast. And it was like a doctor who was listening, who's not yet a DPC doctor, told their family in Colorado to go out to this clinic, and they joined. So it's like literally what you do, like you sharing the mapper. This stuff literally plants seeds in people's heads and people's minds. And this is definitely a way to show that it's like, it doesn't even matter where you are, even if you're across the street. Dr. Erica Young, she, in her interview said, like, there's a DPC across the parking lot from me. And they're both doing great. So I just love that you want examples of how we're not competing against each other. Absolutely. It goes back to that. You love your doctor for them. And it's like, I would feel comfortable seeing a person more so than another person. That's exactly what our patients invest in. Yep. Love that.
Yeah.
And then now tell us about going from, yes, I am unique. I'm bringing an amazing way of my approach to lifestyle medicine and prevention. How did you start then to market in your community?
Yeah, so marketing, that has been, I guess, I'm getting better at it because I'm not a big marketer. I've always known myself as not being one that promotes myself. When I was at 16 years at Grady, I didn't do a single thing. I had a 3,000 patient panel. So you can imagine that was the one that I struggled the most with. But Dr. Matter said something about how he grew his practice, that he will tell every patient, tell 5 people, so those tips I kind of like picked up from people. So the biggest way that I marketed was really word of mouth. So Facebook groups. I'm really big in the community, right? So I'm the physician walk leader. So people come out, for the free walk. I share what I do. Anytime I network in any of our chambers, I mention what I do. And word of mouth with a patient, they will tell other patients. And so that's really the biggest way that I've done it. After a year, I invested in SEOs, which I hear that, does help. I didn't do it the first year because I was advised not to, that let it grow, just organically. So those have been the biggest way. I recently joined Power Core. I did that after a year because, again, they always tell you be in the face of people continuously. So those are the ways. But when I look back and I see what has given me the biggest patient load is really word of mouth and all the Facebook groups that I'm in, the moms group, just adding value and people recommending the practice and more education and really selling what DPC is, because some people still don't know what it's all about and really understanding that. So that's really how I've been able to market. I've done a few interviews with some magazines. I did 3 of them. I actually won Best Family Medicine Doctor in East Cobb area. That got me some awareness because people came. And so there's been those, single things here and there, but it's been multiple channels. I'm a big believer of don't put all your eggs in one basket. So that's how I've done it.
And how has your podcast and your YouTube channel played into your community as well as other doctors knowing who you are and what you're doing?
Yeah, so with the podcast, I certainly have taken a lead for Dr. Una does a fantastic job with her podcast where she shares about so she's adding value, but she's also sharing about what she does. And that was something, and my podcast started in 2020 when I was really fuzzled and I was like, oh, what am I going to do? It was an outlet for me because I really needed to know, am I quitting medicine or what am I going to do? So podcast started then as Living at Your Finest. And certainly when I opened up the practice, I figured, wow, this is a channel that I can also share about DPC. So I do share about DPC and I have people reach out to me that they've heard about the podcast. I do have newsletters that I send out to people that subscribe to my podcast. So that has contributed. YouTube, not so much because I guess I'm not, there's only so much I can do and I want to have a work-life balance. I am hoping to pick up on the YouTube. The YouTube, I used that more when I was at Grady because again, 12 minutes was not enough for me to dive into, issues of congestive heart failure and diabetes. So I'll just share my channel. Well, look at this, read more, and then we can talk about it at your next visit. So that's really how I've been using it.
And seeing you on socials and whatnot, like I was very excited when you started the Walk with a Doc chapter, I guess, being the chapter leader where you are. So tell us about how that has also amplified what you're doing, backed up by you doing walking with the community.
Yes. So I learned about Walk with a Dog a few years back. My former chair, he actually mentioned it. I was like, Walk with a Dog? What is that? So at Morehouse, when I got certified in lifestyle medicine, I saw the organization again. And I'm always a community builder. I like adventure. I was like, okay, this sounds exciting. We can walk together. So I actually was the physician walk leader at Morehouse. We started it at Morehouse. So when I left, the whole idea was to get patients to come out, right? Walk the talk in community. So when I left and I handed it over to another faculty member, I found that in East Cobb where I'm at, there's no Walk with a Dog. They have one like several miles away. And I figured this would be a great way for me to understand my, the doctors and the healthcare providers in the area. So I said I will start one. The goal is definitely to network, know about the wellness companies in the area and let them be guest speakers, right? And then that way I get to know them, they get to know me, and people get to walk. So it's been very instrumental. The biggest benefit that I've had is one of my guests, she has a radio show. I had no idea she had a radio show, but she's a personal trainer. So I invited her to come and speak. And then she in turn invited me. And so when I was on her radio station, the person that carries the camera, she was listening to everything I said. And she signed up as a member, got her mother and her sister. I was like, whoa. So the person that invited me didn't sign up, but the person that's been phenomenal. And then just really networking with all the other healthcare providers, learning about what they do, their services. Because again, I'm new, I'm practicing, I live in the area, my kids go to school there, but I don't know all the doctors in the area because that's not where I practiced for years. So doing that has really broadened my horizon and just helped me serve my patients better. So that's and I enjoy it. I love the walk. We do it once a month. So yeah.
Awesome. Incredible. Who has joined your practice, given that you've been already in practice over a year?
Yes. It's numerous. Not the number I would like, but it's getting better for sure. So I've had quite a few organizations. I had one employee group that also learned about me through the Walk with a Dog. So he's an optometrist, and so his 5 employees have joined. So the goal is to continue to promote, healthy communities through conversations and movement.
And how about in terms of people who are insured, uninsured, people who are coming from a farther distance versus people who are more local?
Okay, so because I practice like 45 minutes away, I had like two patients follow me, and I really do feel really honored that they did because that's a distance. And I know that was one thing I complained about, having to drive 45 minutes or more to work for that number of years that I did. So two patients followed me. I do have a few patients that come from Savannah. That's far, but most people are in the local area, most majority of them. Now, question about insurance. Yes, I do have a few patients that have insurance, but they see the value, but majority of them, let's see, I would say some of them don't, but they just have the catastrophic insurance. So yeah, and I'm affiliated with Hip Nation. So I do get some patients from there. So it's a mix, but those that have insurance, it's certainly not like they're paying a whole big premium on their insurance, right? So yeah.
And you also do immigration physicals. So I'm just wondering, in terms of you doing an immigration physical, has that same trickle down happen like the radio show and the camera woman at the radio show? Have you seen people who you've done physicals for tell their family members who live in the area who have joined your practice because of them sharing about what you do?
Yes. Yeah. So immigration just started, actually. That took a long time to get started. I actually applied for that before I opened up the practice, and it only just came true. And the only way I knew that it came true, is so funny, was somebody called and said, "Oh, do you do immigration?" And then I went on their website and I saw, "Oh, my name is there. Okay, USCIS. You didn't think to tell me." So that just came true. But yeah, so I love the opportunity to do that because then I am an international medical graduate, right? I had to do those examinations, my husband and I. So I love that I get to support, people's American dream. So far, I haven't had anybody sign up, but guess what? They have sent other people to me because I share my flyer with them and I say, "Do you know anybody that, needs a, because they like the area, they sit down, they don't want to get up. So they feel very comfortable." So some of them have insurance. And when I say membership, yeah, they're like, but they know people that don't have insurance. So they give them my card. So that's really been that for immigration. I do one-time offs, and I've had a few convert with that. If not them, then they will tell somebody else. So that's really how I've seen it grow for me so far.
Great. And I hope that that just continues to compound in the future in terms of people, the more and more they're familiar with it, or like they'll hear another person who went to your office, even if it's for a one-time thing, it becomes more real to them. Or they'll reach a point where they're like, "I can't do this anymore either. So I got to find something else." And oh,
Yeah.
look, Dr. Babalola's right there. So
Yeah.
let me ask you now about your journey in not only being a family medicine physician, but also getting these board certifications in lifestyle medicine and obesity medicine. It's funny because I think about how, just speaking to this idea recently, that direct primary care is really primary care. We have a legal term for it right now, but it literally is primary care. What you're doing is it's so intertwined because you can't separate. Like yesterday, I had an IUD visit, someone thinking about IUD, and it was like the periods, the hormones, all of the things are absolutely impacted by all of the other things
Yeah.
that you got certifications in. So tell us how you approach family medicine differently because you're certified. Like you spoke to when you and Dr. Mehta were in his patient's room and you were talking and you were bringing your own take on things to the table. How do you go into a visit differently? Best tips for the listeners who are also wanting to, because they have more time, incorporate lifestyle and obesity medicine into their existing family or primary care practice.
Yes. So and that's the beauty of DPC. You have time. You have time to do this, to spend that time with the patients. So the way I started, I do meets and greets, complimentary meets and greets. And I always emphasize that not only am I a family physician, but I practice whole person approach. And I always emphasize that lifestyle medicine, I tell them about what lifestyle medicine is, a medical approach that uses lifestyle intervention, evidence-based lifestyle intervention. So I'm really big on asking those questions. And so they're fine with it. A lot of them they welcome that idea. They always say that their doctors never had enough time to even talk about their stress levels or their sleep. So I say that during our meet and greet. And then when they decide that, yes, the practice is a good fit, whether it's immediately or maybe many months later, my intake form, it asks those questions. So the intake form, it's quite simple, but it's asking about nutrition, physical activity. And so when they come in for their visit, we're talking about each of them because they've already completed. I always emphasize that they should do their best to, and you only get to do that at least that one time. So we go through that for their onboarding. I look at all those pillars, and it's collaborative. So what are the issues? Again, there's no judgment here. It's just what it is. What are your goals? What are you trying to achieve? Even if it's weight loss, why do you want to, achieve this weight loss? Is it to get off your medicine, or is it to feel more energy? So that's the way, because again, I have the time. I don't feel rushed. Even though I was doing it at Grady, I always felt rushed and I could never complete my notes. And I always had like the medical director sending me hateful emails. Your notes are not closed. That was because I was taking care of my patient. So here it's different because, I have all these skills that I can provide, and then we can work together, and then I can have them come back and see where they are. If they've implemented it, then I remember patients won't come back 3 months, lost to follow. I don't even know if they did anything, because life happens outside the four corner walls of the building. But with my patients, they can send me emails. One sent me just yesterday. I will be so proud of her that she did her routine, her sleep routine, and now she's feeling a lot better. I had somebody that was on depression medicine and was because of sleep apnea and not sleeping well, said it doesn't even need the antidepressants anymore. I've had so many life transformation just because we've spent time taking breaths. I show them how to do the deep breathing, and they get, stress management. And so all the things really add up, even if it's just eating one more serving a day. I have a prescription pad, a lifestyle medicine prescription pad that we write it out. Oh, it looks like this. Let me show you. I love it. This is our prescription pad. So I sign it, and then their names are here. And I say, okay, what are we deciding to do? And then we, for every visit, I have that lined out. So from a scale of 1 to 5, no judgment. Where are you? What else can you do? What have you done well? What else can you do? So it really does make a big difference. And I feel the joy of medicine again, because that's what we all went to medicine to do, right? To help our patients, not just to throw a script and just run out the door and not really help the patient. So that's how I've incorporated it into every visit, sometimes longer, shorter, whatever the patient needs. That's how I adapt it.
I love it. And I will just put a call out too. I was dying laughing when I'm like, you're giving the stand-up comedian physician, Dr. Anand Mehta, who is your neighbor, also a run for his money when you're like, yeah, my notes aren't done because I was taking care of the patient. I love that. We can joke about it now because it's literally true. That's the life that we used to lead. Seriously, this is what you're going to be on my back about, because it's the codes. They need the codes. They need to process those codes.
Yeah.
You also mentioned, clearly as part of lifestyle medicine, especially stress that you address with your patients, the stress that we take on ourselves as physicians, whether or not we're in DPC. So looking back on your 1+ years into your own practice, I want to ask about how you share with other physicians thoughts or takeaways on stress and its effects on the bodies, and how to manage that stress so that we're not, especially in DPC, recreating a system like the one we left.
Yes. I'm glad that you asked that question, because it's so important for us as physicians. We feel like we have to save the problem of the whole world. That is just us naturally, right? We're nurturers, and we feel like we have to take. And I had to get to that point where, even though, yes, I love the practice of medicine, but I felt like I needed to be everything to all my patients. And so even though I love the practice of medicine now, because I spend more time with my patients, I have to be very mindful, because of my natural tendency to want to help and do everything, to create my own boundaries, right? So, and this is a work in progress, right? So it's not like I've achieved, or I work on just making sure that when I do my onboarding, that my patients are very clear that even though I talk about lifestyle medicine, it's so important for me as well to experience that. So that's one thing. I definitely work on my mindset. I love to do things outside of medicine as well, so that I don't feel like medicine is just it, right? I have my podcast you mentioned. I do a lot of community stuff just so that I feel nourished. There are periods where, again, like I alluded to, I'm not the best marketer. I would very quickly educate you, then tell you about my DPC practice, but I'm learning. So how am I learning? I'm learning by being with people who know how to do it, right? So you need to be in communities of people that are doing it, people that can encourage you. I went to the DPC Summit for the very first time, and I met amazing doctors that I went and I spoke to them. How are you doing this? How are you hanging in? Because I had goals that I wanted to meet, and I didn't didn't meet them in December, 6 months. I didn't even meet them in my first year. And I was discouraged, even though I love the business of medicine. My husband has been very supportive. And so shout out to him. He tells me all the time, he's not stressing me, that just take your time. My kids have been, the kids, I don't know that they've been as supportive of the husband, but you do need a community where, they're supporting your dreams and they understand the concept of what you're doing. So that's what I would encourage people to do, to just make sure you create those boundaries, make sure you have a supportive, whether it's family, immediate family, or a DPC forum, those things will help you. And you want to make sure that you have other passions, not just being a doctor. You have to find other things that you create time for. So right now, Wednesdays, I don't see patients on Wednesdays. When I started my first year, I was seeing patients, it was all over the place. It was like, yeah, but now I do networking on Wednesdays. I joined the Power Core. So I figured, okay, well, since I'm waking up early on Wednesday, I might as well do all my networking on Wednesday. And I feel really just liberated because I get to breathe. I might take 1 or 2 calls, but I don't see patients in the practice. Yeah.
Incredible. Thank you so much for joining us today. Be sure to join us on our Patreon feed, where we're going to be talking further about community engagement going into year 2 of her practice, as well as working with a virtual assistant in year 1. So thank you so much, Dr. Babalola, for sharing today. It's so wonderful to see your face.
It's been fun, and I'm so glad to have this great opportunity. So thank you for all you do too. Just keeping this podcast. I know as a fellow podcaster, it's not easy, but you do it so graciously. So thank you so very much.
Thank you for joining us for another episode of My DPC Story, highlighting the physician experience in the world of direct primary care. I hope you found today's conversation insightful and inspiring. If you want to dive deeper into the direct primary care movement, consider joining our My DPC Story Patreon community. Here, you'll have access to exclusive content, including more interview topics and much more. Don't forget to subscribe to My DPC Story on your podcast feed and follow us on social media as well. If you're able, I'd greatly appreciate if you could leave us a review. It helps others to find the podcast. Until next time, stay informed, stay healthy, and keep advocating for DPC. Read more about DPC news on the daily at dpcnews.com. Until next week, this is Marielle Concepcion.